Well, local health providers are encouraging Governor Steve Bullock to continue efforts to expand Medicaid coverage in Montana, saying it's critical for patients dealing with this pandemic. But they also say that even without COVID-19, the coverage is an important way to help people improve their quality of life, as Dennis Bragg reports.
During a roundtable discussion Thursday at Missoula's Partnership Health Center, Governor Bullock noted how the legislature's decision to expand Medicaid couldn't have been timed better, giving Montanans a lifeline for the pandemic.
Medicaid expansion will cover the costs of COVID-19 related treatments as well as continue to pay for routine medical care. Low-income adults in states that didn't expand Medicaid wouldn't be eligible for that Medicaid coverage.
Just as importantly, Bullock says the expansion has given Montana's rural hospitals an important financial foothold at a time when many small hospitals across the country are closing. But those participating in the discussion noted that the expanded coverage is allowing health centers to make a dramatic difference in people's lives. CEO Lori Francis explained the percentage of patients with no insurance has dropped from 50% to 12% since the latest expansion. That's allowing the clinic to help people address other social changes like housing and underemployment that have a direct impact on public health and Montana's economy.
There's a huge stumbling blocks in our society that are not the fault of the individual. And it's a failure of the system, not of the individual. And we need to have things like Medicaid as a safety net to help them.
Quirk told the governor of the painful experience of trying to help a rancher navigate through a health crisis while in fear of losing his livelihood. Missoula small business owner Amy Casso told the emotional story of the fear and uncertainty of dealing with a breast cancer diagnosis while self-employed. Circumstances tough enough already, but doubly difficult during a pandemic.
Becomes that much more essential. I mean, no one should be making a decision whether to forego preventative care or making sure that the only place that they get care is an emergency room because they're trying to choose between literally keeping, a roof over their head or addressing their health care needs.
In Missoula, Dennis Bragg, MTN News.
The governor said the state is still waiting on word from the federal government on the latest round of Medicaid waivers, but says Montana will be able to continue operating under the most recent state legislation.